Hi everyone, welcome back to Bliss. Today we're diving into an important health topic, the warning signs of cancer. Now, cancer is a complex disease with many forms, and often early symptoms can be subtle or easily mistaken for other health issues. But knowing the common warning signs could make all the difference. Let's walk through 10 of these symptoms together so you know what to look out for. First up, unexplained weight loss. You know how we always talk about those stubborn pounds? Well, this isn't about that. We're talking about a sudden, significant drop in weight, more than 10 pounds without you even trying. No crazy diets, no intense workouts, it just happens. This can be a red flag, guys. Many cancers, especially those affecting the pancreas, stomach, esophagus, or even the lungs, can show up with unexplained weight loss. So if you step on the scale and see a big difference that you can't explain, don't brush it off. It's always best to talk to your doctor just to be safe. Next up is something we all experience from time to time but can also be a cancer symptom: fatigue. And I'm not talking about your typical I need a nap after a long day kind of tired. Cancer-related fatigue is different. It's persistent, it's draining, and it doesn't go away with rest. You wake up feeling exhausted even after a full night's sleep. This type of fatigue is often linked to cancers like leukemia or cancers of the colon and stomach, especially if there's blood loss involved. So if you're constantly feeling wiped out and rest just isn't cutting it, it's crucial to bring it up with your doctor. Number 3 is fever. Now, we all know that a fever usually means our body is fighting off some kind of infection. But what if you have a fever that just won't quit, even without any other signs of illness? That's when we need to pay attention. A long-lasting, unexplained fever, especially one that seems to spike at night, could be a sign of certain cancers, like leukemia or lymphoma. These cancers can affect the body's ability to regulate temperature, leading to those persistent fevers. So, if you've got a fever that's hanging around longer than it should, don't just pop a pill and hope for the best. Get it checked out. Symptom number 4 is pain, but not just any pain. We're talking about chronic pain that sticks around and has no obvious explanation. This isn't your typical muscle soreness after a workout. This is pain that lingers, that gets worse over time, and just doesn't seem to have a clear cause. It could be bone pain, which might indicate bone cancer, or persistent lower back pain, which can be associated with ovarian cancer. The key here is that this pain is persistent and unexplained. So if you're dealing with pain that just won't quit, don't ignore it. Talk to your doctor. Let's talk about skin changes. Our skin is like a window into our overall health, so any noticeable changes in its appearance could be a sign of something more serious. We're talking about changes in skin color, like yellowing of the skin or eyes, jaundice, darkening of the skin, or even redness that wasn't there before. Keep an eye out for any sores that refuse to heal, as these can also be red flags. And of course, melanoma, the most serious type of skin cancer, often starts as a mole that changes in color, size, or shape. Number 6 is one we often associate with cancer lumps or thickening of tissue. This is a classic warning sign for a reason. These lumps can appear anywhere in the breast, testicles, lymph nodes, or any other soft tissues. Now, it's important to remember that not every lump is cancerous, but if you notice a new lump or if an existing lump starts to change in size, shape, or texture, it's absolutely crucial to get it checked out by a doctor. Early detection is key when it comes to cancer treatment, so don't hesitate to get those lumps checked. Next, let's talk about changes in bowel or bladder habits. We all experience occasional digestive issues or changes in our bathroom routine, but if these changes become persistent or unusual, it's worth paying attention to. For instance, persistent constipation, diarrhea, or a noticeable change in the size or shape of your stool could be a sign of colon cancer. Similarly, blood in the urine, pain or burning during urination, or a change in the frequency or urgency of urination could indicate bladder or prostate cancer. A chronic cough or hoarseness that just won't quit can also be a warning sign of cancer. We're not talking about the occasional cough or sore throat you get with a cold. This is a cough that lingers for weeks, even after other cold symptoms have subsided. It's especially concerning if you're a smoker or have a history of smoking. This symptom can be associated with lung cancer or throat cancer, as these cancers can irritate the airways and cause persistent coughing or hoarseness. Another potential warning sign of cancer is unusual bleeding or discharge. This can manifest in several ways, and it's always a reason to seek medical advice. For example, blood in your stool, as we discussed earlier, could be a sign of colon cancer. Blood in your urine could indicate bladder or kidney cancer, and unexpected nosebleeds, especially if they become frequent or heavy, could also be a cause for concern. And finally, let's talk about difficulty swallowing. Again, we're not talking about the occasional instance of food going down the wrong pipe. We're talking about persistent difficulty swallowing, often accompanied by pain or a feeling of fullness in the throat or chest. This could be a sign of cancers of the throat or esophagus, as these cancers can narrow the passageway and make swallowing difficult. If swallowing becomes painful, if you frequently feel like something is stuck in your throat, or if you experience unexplained weight loss along with difficulty swallowing, it's crucial to see a doctor right away. Now, I know some of these symptoms can be unsettling to think about, but awareness is key. Many of these symptoms can also have non-cancerous causes, so experiencing one or two of them doesn't automatically mean cancer. However, if you or someone you know has been noticing these symptoms over a prolonged period, it's worth seeing a healthcare provider to rule out any serious issues. Early detection is critical. Catching cancer early can make a huge difference in treatment options and outcomes. If you found this video helpful, don't forget to like, share, and subscribe. Let's work together to raise awareness and encourage everyone to be proactive about their health. Thanks for watching. Stay informed, stay safe, and take care of your health. See you next time.